Good afternoon, everyone. It is 5:59 and our presentation will start at 6 o'clock. We'll give a few other people a chance to get into the audience. Looking forward to talking with you all today and welcome. Good evening, everyone. It is 6 o'clock. We will start probably about 6:01. I see some people still joining in with us, and we want to make sure everyone gets a chance to get into the audience and sit down. And good evening, everyone. It is 6 o'clock. We will start probably about 6:01. I see some people still joining in with us, and we want to make sure everyone gets a chance to get into the audience and sit down. And good evening, everyone. It is 6 o'clock. We will start probably about 6:01. I see some people still joining in with us, and we want to make sure everyone gets a chance to get into the audience and sit down. And good evening, everyone. It is 6 o'clock. We will start probably about 6:01. I see some people still joining in with us, and we want to make sure everyone gets a chance to get into the audience and sit down. And good evening, everyone. It is 6 o'clock. We will start probably about 6:01. I see some people. Not sure what's going on at that point, but I am sure that made you laugh a little bit. Good. I'm not sure. Janaea, are you ready to start, or do you want to give us a few minutes to get back online? Made you laugh a little bit.
We are just having feedback. Let me try to get off of Facebook and
Okay.
but we can get started in 1 minute.
All right, perfect. Well, everyone, we are having a little bit of technical difficulties, but we are happy and pleased that you have joined us today. We will get started in a few minutes once we get our feedback issue taken care of. Sit back and enjoy yourselves. We have a great presentation today, and we look forward to speaking with you. Give us a few more minutes. Thank you. All right. Good evening, everyone. My name is Michelle Evans Oliver, and I am the president of ASALH Richmond. That is the Association for the Study of African American Life and History. We're here today and we're partnered with AARP Virginia. We are excited because tonight we have a special program that will celebrate family caregivers of all ages. As we know that within our African American history, it took a village to bring us where we are today. Children of all ages, grandchildren, nieces, nephews, there were often 3 generations living under one roof to survive and thrive through the times. Before we get started, With the discussion this evening, we have created a short poll to see if there are any family caregivers in the audience tonight. So, Janaea, are you ready with the poll? The first question, if you can answer, are you a family caregiver? You can answer yes, no, or not sure. And there's number 2, were you familiar with the Raised Family Caregivers Act? And number 3, are you a member of ASALH Richmond or just ASALH? And then we have one more. Are you interested in becoming a virtual volunteer with AARP? I'll give you a few minutes, or maybe 1 minute to answer the questions there. We will be happy if you answer them. And we will have an end poll shortly. I wish I had some Jeopardy. Do, 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 do. Normally I do. But if you can answer those questions, we will greatly appreciate it. Perfect. Once this hits 1 minute, I am going to end the poll. Here we go. All right, so the poll, question to number 1, are you a family caregiver? We have 53% said no, 27% said yes, and 3 said they're not sure. Were you familiar with the Raised Family Caregivers Act? And 1 person said yes, and the rest of them said no, and a few said not sure. Are you a member of ASALH? Oh, we have a lot of no's. 73% said no. 4% said, well, 27% said yes. We need to do something about that, don't we? And are you interested in becoming a virtual volunteer community ambassador with AARP? And I can say I am one of those community ambassadors as well, and I love it, and you will too. And we have 13% said yes, 60% said no, and Janaea, we're gonna have to do something about that too. So, thank you for participating in our Sunday sit-ins and our poll. And for those of you who are joining us in Zoom, we have a Q&A that you can go down to the bottom of your screen. And if you see a Q&A, if you click that, then you are able to ask your questions, and we'll be able to answer them. We are recording, hopefully, on Facebook and YouTube, so this will be out to the general public after this, and we might be streaming live. Oh, it looks like we're streaming live on YouTube right now. So hello, YouTube. Thank you for joining us as well. So I am going to now pass this over to our moderator, our lovely moderator, Belinda Todd, who will be helping us and introducing our special guests and talking to our wonderful presenters today. I'm going to turn it over to you, Belinda. Thank you so much.
Good evening, Michelle. It's always good to see you. It's good to be here with the wonderful members of ASALH, as well as any other AARP volunteers who might be in the audience tonight. Tonight's discussion is going to be about family caregiving. And we've got a beautiful family here. We've got an expert in Senator Jenn Kiggins, who's going to talk with us. But first, I want to let you know that AARP has strategically set aside opportunities for you to learn about caregiving. They have a dedicated website. There is the Family Caregivers Facebook group. There is an e-newsletter and even a caregiving resource center that you can connect with, and you will get a live operator. This is a number to reach them. 877-333-5885. I'm going to give this to you again, and then perhaps a little later in the evening. 877-333-5885. You can talk to a live operator, because I know that if you are a caregiver, there are often times that you need to just reach out to somebody. AARP will be there for you. We also work very closely with our state legislators, and tonight we've invited one of our Virginia state senators to join us. We have with us tonight Senator Jenn Kiggins of the 7th District. That's the area that represents Virginia Beach and Norfolk. She is a very interesting woman. First of all, she is dear to my heart because at one time she was a Navy pilot. She's from a military family, but now she's a nurse practitioner. One of the things that's dear to her heart as she advocates for her community is supporting family caregivers. So it's my pleasure to introduce to everyone tonight, Senator Jenn Kiggins. Welcome, Senator.
Thank you. Thanks so much, Belinda. And it's awesome to be here with all of you today with the AARP. And this is a subject that is near and dear to my heart, family caregiving and multi-generational caregiving. So thank you for the introduction. That is correct. I was a Navy pilot for 10 years and flew helicopters and started to have children and have 4 children, got out of the Navy. I was married to another Navy pilot. So I was able to be a stay-at-home mom for many years, went back to nursing school, and my mom's a nurse, my brother's a nurse, and I just special passion for geriatrics. So I went back to study to become a geriatric nurse practitioner, which is where I practice currently in Virginia. In the state legislature, we are part-time. So when we meet for those couple months out of the year, I take time off of my work from my practice, but normally I am a primary caregiver. I've done some work in nursing homes, home health, hospice, but those are my people. Older adults are my special group that don't have enough advocates, in my opinion, especially sometimes in politics, oftentimes a voiceless group, and especially the caregivers are working so hard just to take care of their family members that, those are the people that we often find ourselves supporting. So I've worked in memory. One of my favorite jobs is working in a memory clinic at EVMS, Eastern Virginia Medical School here in Norfolk. And I loved that job. But the primary thing that we did was to support the caregiver. I see the best patient outcomes when we have our patients, our older adults living with family. There's a lot of different ways to age out there, right? Aging in place is lovely, but if you can age in place with a family caregiver, those are by far the best outcomes. You have someone to kind of be watching about medication administration, which is also oftentimes so challenging, just to monitor for safety issues, make sure you're not falling, not driving, you're eating, you're drinking, safety in bathrooms. There's so many issues. So I think that we need to think outside the box because there's nursing homes, but we've seen some of the devastation that occurred just even with the COVID pandemic, and that was rough. And I hope what highlighted some of the issues, not only with staffing, which is one thing I advocate for on a state level, but we isolated our older adults in our nursing homes, and that was hard for them and for our families. So I think there's other ways that we can do this better for our older adults. Aging in place at home with family in these multi-generational settings is one way. We need to find a way to better support our caregivers, though, so that they are able to do things like take time off of work, because oftentimes the caregiver is trying to take care of the younger generation and the older generation. So what can we do to be supportive of that environment? Because again, it is the best way, and we see the best patient outcomes in that setting. So I'm excited to listen to the presentations tonight. I love advocating for caregivers, for my older adult patients on the state level. Please keep in touch if there's something I can do. I'm your point of contact. So I would love to just continue to communicate, with all of you after tonight.
May I ask you one question, if you will? In simple terms, please explain to our audience basically what the Family Caregiving Act does.
So I actually am not sure of those details. That is I believe that's a federal piece of legislation, correct? Okay. So not state legislation. So I don't want to answer incorrectly.
Gotcha. Thank you very much. That's something we should look into then, so that we.
But I'm going to look it up as well.
All right. But thank you for the work you do, and thank you for coming on tonight.
You're welcome. It's awesome to be here. Thanks for the invitation.
All right.
Well, thank you, Senator Kiggins, for joining us this evening and all the work that you do for families here in Virginia. I'm looking at our list of our attendees today, and I want to give a special welcome to Evelyn Brooks Higginbotham, Dr. Evelyn Brooks Higginbotham. She is the actual National President for ASALH, the Association for the Study of African American Life and History. Welcome, I want to give you a shout out. I also see one of our community partners here, Chris Van Tassel. He's with the Virginia Museum of History and Culture. Thank you, Chris Van Tassel, for being here today with us. They are great partners, and we are partnering with them as far as all of our programs and lots of things that are coming up in the near future, so stay tuned. Well, tonight's Sunday Sit-In is going to celebrate our rich history in multi-generational family caregiving. AARP Virginia and the Richmond chapter, Richmond branch of ASALH was fortunate to interview the Quarles family for Black History Month. Let's take a look at the video.
What would you call a joy that knows no bounds? A joy supreme. AARP celebrates Black History Month.
Hi, we're the Quarles family. Started, I guess, growing up in Buckingham County, and at an early age, my family moved to Richmond, and I lived in Church Hill.
My name is Marlo. I grew up on Harrison Street, down the street from Clock Spring in the West End, and I live in Chesterfield now.
My name is Courtney Aaron Quarles Bird. I grew up in Henrico County, and I live in Chesterfield today.
One of my fondest memories growing up was that in my block on 33rd Street, there were 26 of us, and we had a good time. We did many things together, even walking from Church Hill to the north side of Virginia Unions, so when the high schools would play their football games, and we walk home. That was very good.
Only child growing up, and so I spent a lot of time with my grandmother, just me and her. And I would say one of my fondest memories is probably watching The Young and the Restless with her Monday through Friday.
I was younger, and we would come over to my grandma's house for either Thanksgiving or Christmas dinner or any type of get-together, and me and the rest of my cousins would conspire in the separate room to figure out whose house we were going to stay over that night and how we were going to convince our parents that they needed to let us do this. Another one of my fondest memories would have to be the family dance night sessions in the living room, in our house on Ironington Road, just having a good time and playing music on the stereo, and my dad dancing to Run DMC, and me getting yelled at for dancing to Bootylicious by Destiny's Child. Those are my top two fondest memories.
Family is important to me anyway, and because it is important to me, we include each other in whatever we do, whatever we plan to do. They know about it. And so, if we continue to do that, the love will always flow from one generation to the next.
Save important photos that we cherish, journals that we cherish, diaries that we put those things in a safe place, like we do our insurance papers, like we would do our life insurance, like we would do our wills. I think that's the legacy that I would like to leave behind, is just the importance of personal history.
My legacy that I hope to share is that I have the recipes from my grandmother, and I have her cookbook that I had revised this year, and I shall always keep that, and I hope to pass it on to one of my good cooks in the family.
I hope to share a family legacy of hope. Our family has gone through a lot of loss over the years, and I believe that it was hope that kind of drew us together, that made us resilient and depend on each other.
I was told that when I was growing up, that family was always important to you. and that you should keep in touch with as many as you can wherever they are, because family is going to be there for you when nobody else will.
Family is obviously very important to me, and it's a type of love that you don't find anywhere else. It is a type of camaraderie. It is a type of partnership where when you're born into it, you don't necessarily know the end goal, but somehow everybody in your family is working to that goal. Everybody is working to stay connected. Everybody is working to help each other. Everybody is praying for each other. Everybody is, it's really a community. And so that's why I think it's important to stay together and work together, because family is the first community that you have in this world. And I think that that's sacred.
Ladies, you are a beautiful family. It's such a pleasure to have you with us tonight. I just want to know, who is the next good cook in the family?
I was the next good cook, probably.
After grandma, of course.
She has a few good cooks. I'm just not one of them. I'll eat everything. Everything my daughter cooks, she's a good cook. Everything my son cooks, he's a good cook. My niece, nephew, it's just not our generation. It kind of skipped, I think, right?
Well, you know what I have found out, and I am from a very small family, but I have found out that as the years go on, you're going to wish you had those recipes. So I want to ask you ladies, now, did I understand you correctly, Mrs. Quarles, when you said that were there 26 members of your family, or was that just your neighborhood, people in the neighborhood?
That was just the people in the neighborhood.
I see.
6 of us. And some of us still keep in touch.
That's wonderful. You know, there was a time really when the neighbors were an extended part of the family.
Yes.
And they were able to watch out. That's unfortunately times have changed a bit. Let me ask you this. How do you take care of each other? And I know you have some great grands now. Are you a babysitting grandmother?
I'm not really at this time a babysitting grandmother. I have since my big grandchildren were born. I will have them about a week or 2 in the summer. Mm-hmm. But I do look forward to helping Courtney when she needs me. And I will help the others when they need me, you know, but I'm not a continually babysitter at this time.
I see. And Courtney, we see her and we understand that she is expecting in November. Congratulations, yes. Congratulations. Well, ladies, you all look like you're very healthy. How do you take care of your mother or grandmother, and how do you take care of yourselves? Because, you know, our goal is to live healthy, productive lives, even as we mature.
I will say just one piece of information that I think that has been helpful, that my grandmother may not have known that she instilled in me, is that you always need something green on your plate. If you're having a meal, you need a green vegetable and you need to eat all of it. And you really should eat it first before you eat anything else on your plate. So I that's something that has stuck with me. So I really cannot have dinner unless I have something green, a side of greens or something. So I think, you know, just simply eating your vegetables, having a balanced meal, not overdoing the starches, has been what has helped me.
Well, that's wonderful, because we all know about we're not deep South, but we're still South enough that we know what a good Southern cooked meal is. Yes. I wanted to ask you ladies, Well, I want to ask each of you, what is it that you have, I'm glad you said that. I want to ask the others, what is it you've learned? What's an important lesson you've learned from your grandmother? I'll start with Marlo.
I'm gonna say I learned a lot from Mom, Esther Quarles, about family and support. It is, it's number one. We have a family reunion every year. We had to do it virtually last year, but we have one every year for over 75 years, correct, Mom?
74, 75 this year. Yeah.
Yeah. So we have a family reunion, and our cousins, fifth cousins, they're like aunts and uncles, to us. So our family is very close, and it's very important to us.
And I that was instilled in me by my grandmother. We knew our great grandparents, if they were still living, because she made sure that we visited them when we could, that we knew who they were, which side of the family they were on. And she was always what we call a helping person. And so that was instilled in me by her, that family was important to you, and that whatever you do, whatever you need, you will probably get it from family before you get it from anyone else.
Do you, Mrs. Quarles, do you have a lot of, or any other children living outside of the Richmond area?
No, my two daughters live here.
Okay, all right. Where's the other daughter? Wasn't there Courtney?
Who?
No, not Courtney.
My daughters?
I thought there was another. Okay, all right. Well, I want to ask you this. I noticed in your living room, it's kind of the way my grandmother's living room looked, and my husband, who is from a large family, his mother's living room looks all the pictures out. Do you know, when you come home to visit grandma and you see your pictures, it makes you feel special. That is so beautiful.
And that's how my grandmother's house was.
Yes.
Every grandchild she had picture was somewhere in that living room. And I imagine that I have done somewhat the same thing. The graduation pictures, or even pre-graduation pictures, whatever pictures we have, I try to put up so everybody can see, because I enjoy looking at them myself. And I try to show my grandchildren, my family, how much I love them by keeping their pictures out so I can look.
So many families today are scattered. I have one son. He lives in New Jersey, and I have not seen my 5-year-old granddaughter in a year. Now we do Zoom and video chatting, but I haven't hugged her. So what kind of advice do you give to people whose children are away from home, and they need to know about family and who their families, who's in the family and the family history?
Communication is important, I think, and that we should either by phone or whatever way we can communicate with them. And I think that's what we should do. And I think this past year has not been good for any of us, but however, our families have come on and we've played games on Zoom. We've been on Zoom, we've played games, and we've done other things. And so that has kept us in touch with one another.
Yes, and I have to say that AARP and Senior Connects does a great job of virtual activities for seniors. You look like you're in great health, but I know in many families, it's important to make sure grandma gets to her doctor visits and, going to the drugstore and doing errands. Are you still driving, or do you have to, can you count on your young folks to get you places?
No, I drive.
Okay.
And I go, but if I need someone to help, whenever I call, they come.
That's wonderful. That's wonderful. I just, in fact, celebrated a woman's birthday today who was 90 years old. and she's in great health too, but she didn't have a lot of family, and her family members are really her sisters and brothers who are her age. So I think when you have children, they're such a blessing, or can be certainly, as we age. Let me see if there are any questions from our audience. Tell me this, how you're on the computer right now, and just how tech savvy are you?
My grandchildren have helped me with that. I'm not that tech savvy. I can do a little, and I do when they, and they always say, well, Grandma, I have one granddaughter who's here. She said, Grandma, I told you how to do that once before. I said, well, come back and tell me again.
We need that.
I really didn't catch it that time. But all of them will help me.
Yeah, she just recently, actually, the last year or so, got an iPhone. So we could get her into texting. She wasn't really thrilled about that at first, but I think once we told her that she could, talk to the great grands and the grands, and she was on, she was on board.
That's great. That's great.
She does a good job at the texting.
So,
thank you.
Courtney, when you were growing up, what were some of your favorite things to do with Grandma?
Wow, my favorite thing to do was around Christmas time. Grandma would have all the grandchildren over, and we would make cookies from scratch. I just really enjoyed that. We would make, and these are better than the U-Crops cookies. I'm sorry to all the people out there in Richmond, who love the red, white, and green cookies, but we made red, white, and green cookies at my grandma's house, and they were far better. So that's like one of the best times that I had, just having my grandma teach us how to do that, and us getting to pick out the shapes that our cookies would be. I just cherish those times. I'm cooking, and food is really a passion of mine, and I think it's a good way to stay connected to your memories and your family. Yeah. So a lot of my favorite memories revolve around that.
Yes, I think if people have family, especially grandparents, that if they can remember those holidays and the good foods they ate, those are wonderful memories. I understand that you said, Mrs. Quarles, that you were from Buckingham County, your family?
Yes.
Yeah.
We are from Buckingham. I moved here in Richmond at the age of 9. But that's because my grandfather had passed, and my aunts did not want my grandmother just in Buckingham.
I know you've been keeping track of your family. Do you have have you ever done the DNA testing, or do you have any Bibles with the family genealogy in the front?
I don't have a Bible with the genealogy in front, and we haven't done the DNA, but in the back of my mind, where my grandmother, I can give you the generations down to the great grandparents.
I actually have it out. I actually have the generations written out from patriarch David and Sophia. So I have it written.
I want to tell you something else, Courtney. One day, and maybe when the next time your family's around for a holiday, get your camera and ask your grandmother questions. And begin to video her answers, and you can pass it around to other family members. And that will be a blessing to everyone.
Yes, I agree. I think that'd be a great idea.
Yeah, but let's go, trying to get back to family caregiving. It can be a burden on people. It can cause a lot of stress. Did you ever have to care for your mother or grandmother, Mrs. Quarles?
I cared for my grandmother. I was in college. My grandmother became ill my second year in college, and I cared for her. I worked. I went to school full time, and I cared for her. I cared for my aunt, my father's sister. When he passed, he was looking after her. He passed. I brought her from the Tidewater area here, and I cared for her.
Mhm.
I looked after my mother, even though before she went to the nursing home. And I looked after her, and I looked after another aunt.
I think today we have so many facilities that we can take our elders to, but if you can keep them with you, it is so much better. But it is hard work, and we need some strategies to help caretakers. Now, and that's where again AARP comes in. I kind of want you to know that if you were to go to YouTube, there are videos, and y'all, most of them are 2 to 3 minutes long. I don't think there's any over 5 minutes long, where you can get advice on handling finances for those you're caring for. How do you handle the stress yourself? How do you handle the Virginia Code, things that you might need to know about how to handle their taxes, their homes, all of those things that's very important information. And AARP's own Sally Hermé wrote a book that helps caregivers to find this information. I think, are you about? Yes, here it is, the checklist for family caregivers. And once again, there is a number on the screen that you can call. It is important that you understand dementia. And, we're talking to a very healthy family, a woman who is able to get about today, but so often caregivers have to think about parents who become unable. They have to keep a watch over them, and and caregivers need help too. Caregivers need help, and then they need outlets. Like, what can they do to stay healthy themselves? You should never be such a caregiver that you don't set time aside for yourself. Now, help me. I can't see the chat if there are any questions. And another thing is, and Dr. Cassandra Boyd-Willis pointed this out, that there are many families that are not as loving as this family. They're at odds with each other. And some of the, we all know that some of the ugliness comes out at the end of life. So maybe you have seen some of the challenges in other families that you could address those issues.
I have seen some in other families. And I think you don't have to agree on everything, but I feel that you don't have to be disagreeable. And I think that communication is important, and you can sit down and talk about what's bothering you. But in other families, I have seen it to the point that the children don't talk to the parents. They don't talk to each other. The siblings don't talk to each other. It's just confusion all the time.
Yeah. Well, we can tell that your family's not like that.
I hope they never get like that. No, I hope not.
Yeah.
Belinda, I want to just kind of, when you talk about this, I'm very passionate about families. As a financial advisor by trade, it is also always great to talk with the family to see whether grandma or grandfather or great grandmother, they have a will. What happens all too often is that grandma or grandpa or whatever, my father did it as well. He said, "Oh, I have life insurance. Oh, I have all of, my finances are done." His finances were, superb, because he taught me as a financial advisor. But what he did was say he had life insurance, but the life insurance was $5,000. Now, if he did not have a substantial amount of money in his checking account, we would have been scrambling. But I always say as a financial advisor to make sure that everyone has life insurance, has a will, because one thing you don't want is the state to come in and say, we have a will for you. You want to be able to deem those things to your parents and pass them down to the next generation versus having a conflict within the family. So that's just one of those financial tips that I just wanted to lend to everyone, because it is very, I know the Quarles family and they're great with that, but just other families that I deal with on a day-to-day basis that will have a little conflict in between that. So
you know, you may know something about this, Michelle. Now, in my husband's family, a few years ago, they took over the mother's home. They gave, you know, it's no longer in her name. So if anything happens now, if God forbid she lives with her daughter, but you know, there's no problem with the house having to be sold to pay for her care or that sort of thing. So these are things you don't always think about early enough.
Exactly. And that's like when we're talking about Medicaid versus Medicare. And when we talk about Medicaid versus Medicaid, you have a 5-year spend down. And sometimes those homes, retirement, the things that you don't think about during, you know, your 40s and 50s, when you're in your 60s, 70s, and 80s, you're like, wait a minute, we have assets. And how are we going to be able to put mom in a nursing home, or how are we going to be able to afford in-home care? So AARP has a plethora of information online, and if you call your state offices. So we here in Virginia, and I know this is a national call, but if you call your state office of AARP, they will be there to assist you as well.
Yes, I see that Senator Higgins is still with us. Let me just ask you about any kind of efforts in the state that involves family caregiving. Are there any efforts, or are most of them federal efforts? Looks like you're unmuted, Senator.
Can you hear me? Yeah, I've lost my connection. I don't know.
I can hear you. Yes.
Okay. Well, I don't know why I can't. Okay, I'm back. Sorry. That's a great question. And just listening to your discussions about will and about estate planning and that type of thing, I just also wanted to add in the healthcare piece, which in primary care, at least, we always are asking about advanced directives, and having that piece of paper in place and having that discussion in advance about your healthcare choices and your healthcare wishes, and having a person designated in writing that can make decisions for you if you were unconscious or incapacitated. You know, do you want aggressive treatment for end of life measures, or do you want to, as people say, you know, pass naturally, or, you know, what are your desires? What are your wishes? So that piece of paper called an advanced directive is very important. And one thing I was able to have passed on the state level this past year in our legislative session was a requirement for education about what is an advanced directives to be included in a high school health curriculum, because so many people don't know what an advanced directive is and haven't had those discussions with their family members. So what, you know, where was the captive audience that I could make it, you know, a requirement to be taught what an advanced directive is. So now it will be included in the high school health curriculums in the state of Virginia. And I think that's just an important starting point, so that, you know, it doesn't require students to fill one out, but at least educates them. And so maybe they can take that discussion back to their families, because I think that helps to save, not only preserves, you know, dignity of life and your wishes, but also saves some unnecessary healthcare costs in the future, because many of us, you know, don't want to pursue that aggressive treatment, those unnecessary tests and diagnostics. So, you know, what are your healthcare wishes? So I just want to put in my plug for advanced directives. If you don't have one, it's an important thing along with the will.
Every time I go to my physician, they give me that form or they ask that question, you know, have you done that? Well, as a nurse practitioner, let's switch hats for a second. What is there something else that you see seniors need to address that might become an issue for somebody else, for a caretaker, or other than just their basic health needs?
Just have always being mindful of what your choice is for aging. And if you have a family situation that might not best be suited, so you can't move in with a family member, when you are able to, maybe do some looking around, do some shopping around for some of the long-term care or assisted living. Or I'm in Virginia, my parents are in Florida still, and they frequently go around, and they've looked at many assisted living. They're in Florida where there's a lot of choices, but if that's not an option, and we're a military family, so we move a lot, so having my parents with me, even though I have siblings, they are at least doing their role and kind of shopping around and saying, what are some other options for them in Florida? They want to stay in Florida. So I just think, while you're able to drive, while you're able to be independent, and you have your financial, your independence with your finances, what are your options? So making those decisions and then putting those decisions in writing. So it just eliminates a lot of infighting in families. I see that unfortunately. And even in my healthcare setting, I feel like we become social workers or mental health providers sometimes there's some uncomfortable situations. So trying to just ease that burden, I think, for families, and just pre-planning is important.
I have one more question, but and when you began to look at facilities, you really have to do due diligence. Mm-hmm. My father was in a beautiful facility, got good ratings, but we had to be there to let them know. He fell out of bed a couple of times and nobody, noticed. So you got to just still be watchful. There is a question for you, Senator. Does the state of Virginia have home and community-based services waiver programs? Are you familiar with that? One of our callers is asking about it.
What type of waiver?
Does the state of Virginia have home and community-based services waiver programs?
There's different, like, adult daycare type programs. I'm not quite sure what you mean by waiver programs, but there are many options as far as private duty, in the home care. That's not home health. So home health is generally covered under insurance and Medicare, but then there's a private duty care component that is frequently private pay, usually private pay, roughly $20 an hour. So that's, for a couple hours a week, or if you need a couple hours a day, or whatever the requirement is to have someone come in the home, that's usually a private pay service. But home health is usually something that's followed up after a hospital stay. And sometimes there's a transitional program, so it would be home health to hospice type of situation. So there's different options out there. I'm not sure we call them waiver programs, but
yes, I think in your community, you usually have an area, area agency, area on
for the aging.
Yes, and they have a plethora of information.
Yes.
Area agency on aging, that's what it's called.
And
yes.
Yeah, and depending on where you are, and we have Senior Services of Southeastern Virginia, which are wonderful, but the agencies on aging are wonderful. So each state usually has a division on aging. Even our mayor's office has a division for aging that puts out a wonderful resource guide for the city I live in, for Virginia Beach. So do check, your local resources in your local government. Reach out to your state representatives and your city council members, and they may be able to just point in the right direction for local resources.
Thank you. Thank you for being willing to enter into our conversation.
Yeah, anytime. It was awesome to hear from the Quarles family as well. They're a great story.
Yes, they are. And so, it's lovely to see Mrs. Quarles. She's in great health and she looks beautiful. But we are in a society where more and more people are aging, and the seniors are becoming a large part of our community. So what we're finding is, even in, I'm in Petersburg, but between here and Richmond, I'm noticing more communities being built. that cater to seniors. And I think that's a wonderful thing. But I hope that some of these places are affordable, because unfortunately, everybody will not have unlimited resources once they have retired. So there's a lot of work that we have for seniors. And I guess as a senior myself, I need to be out there advocating.
Yeah, Belinda, I wanted to give a plug in for ASALH. If you go out on our ASALH website, we have information. So we talk about getting together as a family, building generations by generation. We also talk about generational wealth. We talk about bringing families together. And that's that's our major theme for this year. So if you go out to ASALH, which is ASALH.org, we have information regarding family. So when you have your family reunions, you can come together, as you said, Belinda, and do your videos, make sure you have information, just gather as much information as you can. But during that time, ask the very important questions is what you're asking now. How will people be able to care for Big Mama? Or how will people be able to care for Uncle Buck? Because those are the important questions that aren't ever asked during the family gatherings. And they're hard questions. And some people might not want to ask those questions, but those questions have to be asked. So during your family reunions this year, hopefully we'll be able to get together because of COVID. COVID is almost, crossing fingers, almost gone. If you get your vaccinations, ask those important questions, go on our website for ASALH.org, find information, and then go to ASALH in your area. We have about 30 to 40 different branches in different areas of the United States, and they will be able to assist you. I just wanted to give my shameless plug there.
Yeah, there are two things that I want to talk about, and that's wonderful. You're a wealth of information, Michelle. Thank you. ASALH, everybody who didn't know, stands for Association for the Study of African American Life and History. And it's located in Richmond. Where are you located?
So ASALH was founded in 1915 by Dr. Carter G. Woodson, who is originally from Buckingham County, New Canton. And I had to put that plug in, Mrs. Quarles. And it was founded in 1915. And so it's in the national headquarters is in Washington, D.C. The Richmond, Virginia branch was chartered in 2020. Yeah, 2020. I had to remember that. We started the organization, bringing together people back in 2019, and we were able to be chartered in 2020. So we're excited to just kind of get our feet wet and, help the community with whatever we can put our hands on. Of course, we're working with AARP. We're working with the Virginia Museum of History and Culture. We have a plethora of people that we have gotten in contact with, even through this COVID season, to help us get the word out for anything and everything. So stay tuned and join our Facebook page. We have a Facebook page. It's ASALH Richmond, ASALH Richmond, or you can reach us at ASALH RVA info. We'll put that out in the chat so that you can reach us for membership information. And we do so much, and I would love to give you information about that. So I am going to dial back now, and I want to hear a little bit from the Quarles and Senator Kiggins, and then we'll close with Dr. Cassandra Boyd Willis. So thank you so much for joining us today.
I don't want us to forget about veterans. Now, I know Senator Kiggins is from a family of military family, but they also require special kinds of caregiving. So we have to remember that. I want to end with one last question with Mrs. Quarles.
Yes.
And that question is, as a senior who probably has received every gift you could probably ever want, what is it you'd like for your children to give you come next birthday or Christmas or the next Mother's Day? What can they give you?
I don't want them to give me anything materially. material. All thing I want them to do is to show me love, respect, and kindness as they have always done. And if they do that, or, you know, just call me once in a while. And I tell them, you don't have to give me a gift. Just call and say, Merry Christmas, Mama. Happy Mother's Day, Mama, whatever. I am most grateful for that.
I knew you would say that. As a grandmother, a new grandmother myself, all I want is that phone call. And in just a couple of weeks, I'm going to be able to hug my baby. So listen, ladies, thank you so much for sharing with us. I have right now, I want to present to everybody Dr. Cassandra Willis Boyd. And she's going to tell you about what's coming up next. And I understand that she's actually a friend of yours, the Quarles family.
Yes.
Right.
Yes.
Yes, I know. And I'll tell a little story. I met Kelly, one of Mrs. Quarles' daughters, and the way that Miss Quarles and her husband raised the kids, I did not know that she even had any more kids because I thought Kelly was the only child.
She act like it. She's a baby.
She does. You're right, Marlo, she does.
So camaraderie, friendship, and legacy, that's certainly what we heard from the family today. Thank each and every one of you for joining us. And thank you to the Quarles family for loving on one another intentionally and keeping family as the most important part of life. I'm extremely blessed to be connected to each one of you. Mrs. Quarles has been an anchor and is respected in so many circles, church, Girl Scouts, community, and certainly for her work in bringing families together other than her own and supporting families through some tremendous times. She has ushered her own family through many challenges, and for those of us who don't have this, it's truly a blessing and inspiration. Taking care of family has been a pillar of the African-American community for hundreds and thousands of years. And so it's been wonderful sitting here. I felt like I was in your living room, Ms. Quarles, sitting here and seeing what a stable family looks like. Sort of kind of the opposite of what we sometimes see in the media. Certainly not without challenges, but certainly with a lot of love. Our next and final Sunday sit-in in this series will be held on June 27th from 6 to 7 again. And we will hear from our own ASALH member, Dr. Carmen Foster, as she talks about work in the school system and teachers and segregation. If you have not heard Dr. Foster speak, you are in for a treat. She is certainly a historian. We'll see some unique stories of Richmond's early history and desegregation, and then she'll highlight some teachers in the movement. And if you're from Richmond, you will see some people you know. Again, thank you all for joining us, and we look forward to sitting in with you again next month. Thank you all.
Thank you.
Thank you.
Yeah.